My name is Quinnell Breeden, and today I will be presenting to you my stance on why we should not be reopening our educational system come August. As you can see, the title of my presentation, The Dangers of Engagement, Classes Canceled. It is clear on my objective stance as to why we should not be reopening our schools come August. Hopefully, throughout this presentation, my stance will be more vividly portrayed to you, and if you yourself perhaps will even reconsidering attending courses come August, then maybe this presentation will also help to sway you otherwise. Because this is education, is the most responsible method of education for our society at this point in time in regards to public health. Now we will address certain aspects of our society that will show you why distance education is actually the most reliable method at this point in time, all right? Heck no, we won't go. Also, because there are breaking news updates daily in reference to the coronavirus pandemic. Now, with that being evident, there is really no point in time, at least in the near future, that we can see where it will be safe to reopen our educational system fully. All right? With that being said, the most responsible means of education, as I stated previously, are distance educational courses, okay? Now, all classes in campus, on campus, or in schools should be canceled. And distance educational online courses should be constructed in order to meet the educational needs of staff and of the students, all right? Now, that is going to be the biggest and safest way to ensure that we reduce the spread of the coronavirus. All right? Here's our agenda. We will address the medical readiness of our society. Do we have strategies in place to ensure that we are able to contain the coronavirus pandemic in its place? Are we able to stop it? Are we able to reduce the spread? All right, those are things that we will be addressing today, as well as the habits of our society. That is a critical concern that needs to be addressed in regards to reopening our schools, if we are to even consider reopening our schools. Also, we would like to take a look at congruence. What have we seen in the other areas of society that have already been open? Do we have reliable containment plans in place to ensure that the spread of the coronavirus won't increase? And how have people adapted to the areas of society that have already been reopened? Now, all of these are things that we will address. Now, here we have with medical readiness, we have to address medical equipment, PPE, we have face masks, and not only face masks, but what happens when somebody actually contracts the virus? Do we have enough testing kits? Do we have enough hospital supplies? Because hospitalizations have been on the rise constantly since the onset of the coronavirus outbreak. It hasn't slowed, it hasn't stopped, so why should we reopen our schools and subject ourselves to the risk of the dangers of engagement? Okay, now we need to address the issues of community transmission. The majority of our students are between the ages of 18 and 30. Now, granted, the mortality rate is of elderly, but these individuals are at the highest for contracting. The individuals 18 and 30 I'm referring to are at the highest percentile when it comes to contracting the virus. Now, if these individuals are at the highest rate of contracting the virus, and then they go back out into the community, and then they engage with our elderly, what do we have? Okay? Now, another issue we would like to address is the habits of our society. Risky behaviors. Now, in that age group, 18 to 30, now they know they're not really the ones dying from this disease. When you know you are not as susceptible to fatality as another age group, then you are more susceptible to partake in the lack of social distancing, partying, mass gatherings. All of these are risky behaviors that are habitual in our society. Cleanliness, how are we going to combat the lack of cleanliness within each dorm and the facilities in which these students are supposed to learn? Okay? Do we have the staff Do we have the availability of staff? Do we have the availability to pay that staff to perform daily cleaning regimens? Not to mention, not only are they daily, but they occur numerous times throughout the day to ensure that the coronavirus isn't spread. Okay? Now we also have to consider the dangers of engagement. We also have to consider the dangers of engagement as relevance to congruence. See, our gyms are not open right now, and for good reason. Okay, the majority of the members going to the gyms are between the ages of 18 and 30. Now, there are some elderly, however, the majority of the individuals going to the gym are between the ages of 18 and 30, all right? Now, our restaurants and our bars, they are only open at 50% capacity on dining services, and for good reason. Now, even though they are only open at 50% capacity, do they even have the means to ensure the cleanliness and the decontamination and containment processes of the coronavirus? No, I don't think that they do. And these statistics are evidence of that. These are the coronavirus cases in North Carolina since March. You see no drop at any point on this graph. Do you see any drop in the hospitalizations that have occurred in North Carolina? Now, this is only North Carolina that we're looking at. This is not even the entire U.S. or the world. We are not ready to combat this coronavirus, and the data simply backs that stance. All right, so the coronavirus cases, again, have steadily risen since March.